Hi, this is Bob, and welcome to Off the Cuffs. I'm excited today. I have Dr. Speaks with me, Chief of Staff at Novant. I'm glad for you to stop by and be with us this morning.
Thank you so much for allowing me to join you.
I appreciate that. Well, when I hear the word Chief of Staff, I'm thinking the White House. When I hear Chief of Staff of Novant, what does that mean? Tell us about you. I heard you tell me earlier you were from New York, right?
Right.
The Bronx.
Born in the Bronx, raised in Westchester County, which is a suburb of New York City.
Okay.
And I moved to Winston-Salem right before high school. I attended Mount Tabor High School right here in Winston-Salem. So this area has been my home for quite some time now. I grew up at that time it was Bowman Gray Medical Center off of 40, and saw that and said, that's where I want to go to med school. So I wound up at the University of Virginia in Charlottesville for undergrad. Then came to med school here in Winston-Salem and completed my residency training here as well.
Wow. So what does the Chief of Staff do at a hospital? What does that entail?
So I'm at Forsyth Medical Center, which is a hospital within the Novant system. The Chief of Staff is a representative of the medical staff of the hospital, which are comprised of people who work for Novant like me, but also other community physicians and advanced practice practitioners such as PAs or nurse practitioners. And basically I serve as a liaison for the clinical medical staff to the administrative staff, the people that help, form the rules and regulations that we comply with to kind of do our day-to-day business safely and effectively. And then we all report to our board of trustees for final approval of who comes on to medical staff, extension of certain clinical privileges, and if we want to amend or make any changes to policies.
How long have you been the Chief of Staff over there?
So this is my first year. Yes.
Wow.
I was Vice Chief of Staff under Dr. Scott Berger, who's a surgeon locally, 2 years prior. So it gave me good lead time to learn from him.
Okay.
I also served on the Medical Executive Committee, which is the committee of medical staff leadership that represents the different subspecialties in medicine that practice at Forsyth, and as well as our Kernersville and Clemens Medical Center locations. And I represented Women's Health as the chair of obstetrics and gynecology.
Wow.
So that gave me a perspective to the inner workings of kind of administrative medicine.
So when you look at your role as the Chief of Staff, right, and you look at what Novant does, and you say Winston is home and you're a graduate of Mount Tabor, what do you see, or how do you see Novant in your position meshing with the community? I always ask people that when they come and they sit and we talk. We have people from all walks of life, and I always ask the question is, how do you see what you do and who you represent meshing and making Winston-Salem, Forsyth County better?
Yeah, I love that question, because I feel that being a part of the community in every possible way is, part of the heartstring that kind of combines us or joins us at Novant Health.
Mm-hmm.
In this day when there's so much information and uncertainty as to where accurate and good sources to get information, it's really important that we, as medical community, establish ourselves as a trustworthy member of a community. And I think reaching out into our community and making sure that we're involved in all components of a community's health. Mm-hmm. So not just you come to us, but we come to you, are kind of hallmarks of what Novant Health tries to do. I think historically, if you look at where doctors' offices are, mm-hmm. They may not always be equally represented in communities that are diverse, they tend to be geographically located on one side of town and maybe not as present on others, and
You think that's by design?
I don't think it's by accident. And I think when we have an organization to say, hey, let's recognize this, let's talk about this, and then let's put clinics and healthcare opportunities in people's community, which Novant has done with Today's Woman, as well as both adult pediatrics and women's health in the Wautown area, but also to support the other things that we know that make communities healthy, as far as health literacy, access to food, access to medicine, health advocates. Implementing those things in our community are important, not just, clinic offices. And I think that represents the spirit of what Novant brings to our community.
So how long have you been with Novant?
This will be my 9th year coming up in the summer.
Wow.
Mm-hmm.
9 years with Novant.
Yeah.
And so when you entered Novant, what was your position you entered as?
So I'm an obstetrician gynecologist,
Okay.
as that's my clinical specialty. So even though I hold the title of chief of staff, I still practice medicine full time and taking care of women throughout their lifetime, particularly through their reproductive life and beyond. So I started as a general OBGYN physician, which is what I still do. Mm-hmm. So I'm with Novant Health Woman Care, and we deliver babies.
Tell me all of that.
I'm
Okay.
sorry.
Yeah, okay.
We deliver babies at Forsyth Medical Center. We have office locations here in Winston-Salem, as well as Clemens and Kernersville. I'm also medical director of the Women's Health Office in Wautown, so Wautown OBGYN, which is also a Novant Health practice.
Well, I got to switch gears now because I was actually going to put you on the spot when you said chief of staff and Novant. I was actually going to throw you a fastball with a little curve on it, but I'm going to back up.
Okay.
So, that's interesting to know that. So you deliver babies. That's all right.
Yes.
So let me ask you a question. So do you work like in a NICU unit, or you work like, and I say that because one of my boys was premature, and over his lifetime, I still get letters from Novant tracking his progress, right? And so that's interesting when you said that. So as a OBGYN, am I saying it right?
You got it perfectly.
Okay. So do you see, when you see babies born and you see the struggles and so many things that are happening, and like you said, in certain parts of the town, what are some of the things that you see we can be better at in some of our highly impoverished areas where people don't have access to medical care, where they don't have access to all the things that it takes to at least have a fighting chance at having a healthy baby? And I say that because I had a gentleman who, I forget his title, who was responsible for tracking death rates and illiteracy rates in the African American community, people of color. And he talked about the rates being so much higher than it was in our counterparts. And so as someone who is an expert in the area, I'd like to hear your thoughts on that. Tell me, what can we do better? What are some of the things that you see that if you had a magic wand, you could just, there it is.
So I love that question because I think it reinforces the importance of not just providing healthcare, but providing healthcare with knowledge of people's environment. And that's why it's important for us not just to have a cluster of clinics and offices that are geographically unbalanced, because we know what people experience, and as far as access to resources differ greatly by zip code. And we also learn from what we see. Not all of it has to be taught didactically or through a book or lectured to, you know? So if we can model what health looks like in all communities, we know that the healthier a community is in terms of young women having access to nutritious food, having an opportunity to get exercise, clean air, clean water, that only impacts the future generations. That means she has a healthier pregnancy where she's less likely to have conditions such as high blood pressure or diabetes or preterm labor or other conditions that would warrant an early delivery. That sets that child off, significantly. And our NICU team and our pediatrics team do such a great job in trying to leverage that. So for children like your son who, for whatever reason, have to unfortunately have an early start, that they give them all the love and medical attention so that, at certain milestones, you can't even tell. But I think that they were born at an earlier gestational age than maybe a term baby. But I think the emphasis needs to be on making sure we have, equitable access to resources that we know historically make us healthier people, so that's environmentally clean air, clean water. Do we have place for people to exercise? Do we have healthy food options? And then do we have people in our communities that are allied or allies with healthcare systems who look like us, who understand our cultures, who speak the same language we do? Those are all important factors that can lead to a more successful and healthy pregnancy.
So I got two questions that's running in my head. One is when you talked about checking on to make sure the progress, it took me back thinking about my son. While he was a premature child, his intellectual ability is off the charts, highly intelligent, but his maturity is lagging behind his age. And so it's interesting when I get these letters from Novant, I guess checking up, following up, want to be a part of the various studies. I find that to be very interesting that 17 years later, they're still checking and monitoring. So I applaud Novant for that. But where I was going with this next question is that being from this community, and I've been amazed. I've been in office now 2 years, 3 months. And I've been amazed at some of the people that God have allowed me to meet. People of influence, highly intellectual, people who collectively could change the trajectory of this community, this whole community as a whole. I think about one of the gentlemen who was here, who is head of the health department here, director of health here. And we were having a conversation about, and what sparked that question was when you talked about zip codes. He talked about in a particular zip code in our county, the life expectancy is coming up on 13 years less than anywhere else in the county. And some of the causation and factors that he listed was healthcare and access to healthcare. And I hear that all the time, when I go over to the detention center and working with the healthcare provider over there, and you have residents over there who have not had access to healthcare. And I always ask this question, and maybe it's not a fair question to you, and then maybe it is, but from where you sit as chief of staff, you've got to see the same thing that these folk are seeing. And when you see these things, how do we change that? In other words, I have people who come and sit, and they are people of influence. They are people like yourself who have been tried and tested and can make phone calls and things start moving. And I wasn't born in Novant. I was born at Cape Bitten, is what they used to call it, over on Highland. That's before they ever built Novant. I don't even think Novant was built in '61. But anyway, I'm just amazed that in certain parts of the community, there is no hospital. But I get on 40 and head 40 west, and every mile I got a hospital that's capable of handling trauma situations, from heart attack, stroke, to gunshots, so they can get me somewhere. But yet, when we have these conversations about the causation of a 13-year difference of life expectancy, healthcare and access to it is always at the top 3. But yet, I don't see any movement toward that way.
Mm-hmm. That's an excellent and absolutely valid and fair point for discussion. And I think, there are institutions in this country that historically have not served the community in a balanced and just way, and have done disservices, actually, And I think when we are at a place in time where the leadership that represent those institutions, whether they be my organization within a healthcare institution, or government, or business, when we're ready to have those conversations with everybody, that's where we'll start to see change. And I think as Chief of Staff, I have the honor and privilege of kind of dictating some of the conversations that we have as a medical staff community at Forsyth. And every time we meet monthly, we make diversity, inclusion, and equity a first order of business. Because I think for so long, there was a lot of impetus on looking at communities, particularly low-income communities of color, looking for the people to change in that community, saying, well, you have to do this, this, and this, and be prescriptive about it. And there was not always an outward expression of being willing to change within our own organizations and institutions and how we relate to communities. And I think I feel very confidently in saying that we're seeing that transition. I think we're seeing outreach and value with leadership within those communities to hear ways that we can make a difference, because it may not just be what we think people should do. And so while that may not initially translate into a new hospital being placed in a certain zip code, what I do think it translates to, which is a little less tangible, a little less visibly obvious, is strengthening relationships, engendering trust, and being co-leaders in a community to work towards a goal that we set together, instead of one party trying to tell the other party how they should do it and what to do. So I think it's a walk we need to take together, so that we make sure we're meeting the needs according to the people in the community, not just based on what we think. And hopefully we'll start to see some of those more visible and obvious changes, such as structures and hospitals and stuff, appear soon.
So let me ask you a question. Who's the president of the hospital now?
Chad Setliff is the president. And
Setliff?
Yes.
How often you see him?
We talk frequently. He was on the phone with me.
Can you give him a message for me?
Absolutely.
Look, tell him I never met him.
Yes.
But tell him I like for him to, 1, come and be a guest.
I'm sure he would love it.
And 2, I need for him to set up a hospital, not necessarily a full-fledged 12-story building, but I need for him to set up something, 24 hours emergency care in a particular neighborhood. Tell him to come see me and we could talk about it.
I love it. I will definitely.
Because I feel like this, with you and him and a few people walking together, we could get it done.
Right? I love it.
And I subscribe to this thing about time and turn. I say it quite frequently that in life, sometimes it ain't time, sometimes it ain't your turn, but every now and then time and turn aligns. And when those time and those turns align, that's when the magic happens, And I think that having this conversation publicly, having you as the chief of staff and maybe having dialogue with him and getting some more people involved in the conversation, I think that we could change the trajectory, we could change lives, we could change a community by something as simple as putting a place where people could go to get that Class Act first level treatment that you all provided Novant.
Yes.
I mean, you would change the morale in the community. You would give people hope that don't have hope. But that just came to my spirit when you and I were talking. And I said, you know what? I'm gonna throw it out there at you and see what happens.
Let's make the conversation happen. Now, as much authority and as great of an individual as Chad Setliff is, we would certainly expand the ask to, because he also reports to our board of trustees. But I think this is a conversation, maybe inviting you to come chat with us too.
I would love to come chat with you.
We would love to hear your perspective, because you see every nook and cranny of our community, and that's important for us to hear too. So
I would love the opportunity to sit with you, the president, as well as the board of directors. I would love that, because barbershop conversation is real, beauty shop conversation is real, and as they say, conversation that I hear from those that don't have any hope. And I hear the voices of the rich, middle, the poor, and those that don't even have a voice.
Right.
And sometimes I get conflicted as to, am I the sheriff? Am I supposed to be, championing this, championing that? And I've come to realize that if I don't champion certain issues that are social issues, today, while there are social issues, tomorrow there'll be criminal issues. And so, I see that every day when I go into the detention center and I see residents and I see men and women who hadn't seen a doctor in 10, sometimes 15 years, and they have a host of problems that affect them that could have been prevented. And so that's why I was excited when I found out you were coming. I was, because I know that anything that says chief of anything, it could be chief of the community club, chief of the Checkers organization. You have influence. You have say. And chief of staff of Novant, you didn't get there just by beautification. You got there based on academics and a lot of other things. And so to have you as the chief of staff, I'm grateful that they chose you, because my spirit tells me that you can get this done. You can make some things happen. And so I welcome that conversation. And I know a lot of other people will love to be a part of that conversation, because I hear it all the time, when I'm in the barbershops, on the streets. And I guess people think that the sheriff he talks to everybody. I don't have any authority. I'm just blessed that God has allowed me to be in this place. But anytime I can lend a voice to something that I think is life-changing, I'll be the first to open my mouth. So I had to put that out on the table.
I love it.
And hope that this conversation materializes into something other than a conversation.
Yeah.
So I'm going to go back to where I was. So what's that like? You have family? You have kids?
Yes, I have a 9-year-old and soon to be 11-year-old.
Wow.
He turns 11 on Saturday.
Wow. He's almost a teen.
He's almost a teen. He's almost taller than me.
Yeah.
And so, we're excited.
What's that like being chief of staff, chief of home, delivering babies, all of that? What's that like?
It keeps my life very fun.
And your phone ringing, that's what I was about to say. And my phone ringing.
And my phone rings.
Yeah.
No, but it just makes me really appreciate the people around me who allow me to be multifaceted in that way. I couldn't do it by myself, obviously. I have a wonderfully supportive partner and family. I have a wonderful team of doctors, nurses, nurse practitioners, and PAs in my office, and administrative folks as well, who help me juggle a clinical schedule with some of the other things that I do. My passion is kind of seeing the people who contribute to the inner workings of the finished product, you know. Even like when I go into the grocery store first thing in the morning and everything's laid out very nicely and organized, there are people who worked very hard and took passion in their job to make it happen so it looks perfect for me as the consumer. And the way I'm able to do the different things that I'm currently involved in is all the people who make it frictionless for me.
Wow. That's all right. So I want you to know that I have truly enjoyed talking with you. And I want to thank Novant for choosing you. And I want to thank Novant for being a part of this community. And I say that because back in last year when COVID hit relatively hard and they were closing the schools and we were looking for partners to help us set up these care locations, Novant stepped up to the plate and made a contribution to help these children in these high-risk locations get the care that they needed. They didn't ask any questions. They stepped up in a huge way, and they hit a home run. And I'm grateful for that. And so to have you sitting here representing Novant means a lot, that they thought enough and you thought enough to stop by and have a conversation with us today. So before I close, I want to let you say anything that comes to heart, anything that you want to share with us.
I'm just honored to have this opportunity to get to know you,
thank you.
And for us to build, relationships, to continue to strengthen our community and serve our public in the best way possible.
I appreciate that. So, as always, I have enjoyed this conversation. This one goes to the top of my list that I'll watch again. And I'll tell you why, because I'm hoping and I'm praying that this conversation where we talked about bringing a different type of healthcare into that high-risk zip code, this was the beginning of that conversation, and it will grow and materialize into something that we talked about here and we made happen. Because, when they say when one or more touch and agree, that's when the magic happens. So I'm just believing that we have touched and agreed, and it's going to happen. As always, this has been Bobby. I've been with Dr. Speaks this morning, Chief of Staff at Novant. As always, thank you for watching. I love this city, this county, and this country. Thank you.